Well, good morning, everyone. Hello and welcome to today's webinar presented by Frederick Health and ACOEM, focusing on adult vaccination uptake improvement program. We are thrilled to have you join us today for this important and timely discussion. My name is Nikki Hoffman. I'll be ACOEM's staff moderator for today. Before we begin, I'd like to cover some housekeeping details. We have some interactive features. There are two features available for communication during the webinar. We have the chat feature. You may post general messages in the chat. Messages can be shared with either the panelist or all participants. Use the drop-down menu to select your audience. Let's start by introducing ourselves. Please share your role and location with all panelists and attendees if you would like. For questions today, we ask that you please submit those in the Q&A box located at the bottom of your screen. This is the best way to ensure your questions are seen and addressed. Please avoid posting questions in the chat if possible. For those who are unfamiliar with ACOEM, we are a membership organization dedicated to promoting the health and safety of workers, workplaces, and environments. We achieve this through education, research, policy development, and advancing the field of occupational health. Please note that today's session is being recorded, and the recording link will be emailed and available on ACOEM's Online Learning Center following today's webinar. We are delighted to have Dr. Radke and Ms. Krista Rogers as our faculty today. They'll be giving us an in-depth look at Froedtert's Adult Vaccination Uptake Improvement Program. The initiative launched in May 2024 to educate and inform unvaccinated patients about the benefits of flu and COVID vaccines. They bring a wealth of experience and expertise to this program, so please give them a warm and virtual welcome. Again, as a reminder, please submit your questions throughout today's webinar, and we will take those at the Q&A box at the bottom of your screen. And now I'd like to go ahead and pass over the presentation to Dr. Radke and Krista.
Thank you so much, Nikki. We'll go ahead and get our slides going for you all. We'd like to thank ACOEM for giving us this opportunity to talk about our adult vaccination improvement program, and also all of you for joining us today and participating in this webinar. It's our pleasure to share our experience with all of you. The two of us will tell you a little bit more about ourselves. We do not have any relationships to include or to disclose to all of you. I'm Dr. Laura Radke. I'm the Senior Medical Director of Occupational Health Services for Froedtert and the Medical College of Wisconsin in Milwaukee, Wisconsin. Been here in this role for about 7 years, and we have a number of external facing clinics serving clients in our community. We also take care of our own workforce, and we provide services in on-site clinics and manufacturers throughout Southeast Wisconsin. Krista, would you like to introduce yourself briefly?
Sure. I'm Krista Rogers, physician assistant in Dr. Radke's department, mostly in our external occupational health clinic. And I've been with the department about 7 years, and I help with some of our more tech report type things. So I'm happy to touch on that today.
Thanks, Krista.
Mm-hmm.
So just a quick disclaimer that we needed to share that this initiative is supported by the Centers for Disease Control and Prevention. It's part of a financial assistance award to the Council of Medical Specialty Societies, 100% funded by the CDC and HHS. So our content is ours today. It does not necessarily represent the views or the endorsement of CDC, HHS, or the US government. So the objectives for today's talk, the first thing we're going to do is go through the Adult Vaccination Uptake Improvement Program that we started here at Froedtert and describe its goals. We'll go over the program's geographical reach and how we've expanded the program over time, talk a little bit about how the providers were trained and were engaged in participating in the program. And then lastly, we'll discuss how the data is tracked and what we've used to monitor program success. So to start with, we're going to introduce you to our two primary clinic sites. When we decided to start this program, we chose 2 out of our 7 clinics to be used as primary sites for the program. One of them, the one that's on the left-hand side of your screen, is our North Hills Clinic, which is located in Menomonee Falls, a suburb on the northwest side of Milwaukee. And the other clinic on the right is our McKinley Health Center, which is located in downtown Milwaukee. The reason we chose these 2 clinics was for 2 purposes. One of them was geographic and one of them was population. So our Menomonee Falls Clinic is a suburban clinic, but it does serve a wide variety of individuals. The northwest side of Milwaukee is very close to this clinic and does include a racially diverse and economically diverse population. But it also taps into some of the individuals and some of the clients we have who have locations in a more suburban location. The other location, the McKinley Clinic, is downtown. It's actually almost across the street from the Fiserv Forum where the Bucks play, and the Bucks actually use part of the building as a training center. So it's very centrally located. It also is on the fringe of our downtown, so very, very close to a number of government-funded housing projects, a lot of neighborhoods with economically disadvantaged individuals who have access issues. It's one of the reasons that the clinic was built in that location. So right at the off ramp for the freeway, which is also super convenient for people. So some people do come from elsewhere, but a lot of the population there is actually our own employees. We have a lot of employees who work and live in the neighborhood surrounding that clinic. And so we were able to tap into our own employee population as well as that from the surrounding community. So the pilot sites, we started that program with some providers who are really motivated. So I want to share that with you right off the bat. We have an occupational medicine trained physician at our North Hills location who is very passionate about population health and about total worker health. So she was quite engaged. And then we have a nurse practitioner at our McKinley Clinic who's also pursuing a PhD and is doing some of her work related to health discrepancies in underserved communities. So great providers. The providers who work at these sites participated in a motivational interviewing training, which helped them to better address vaccine hesitancy. And so we went live on May 1st with those 2 pilot clinics. As I mentioned, because of the providers' excitement and drive, we had great participation amongst the providers there. A basic overview is that the providers talk to the patient, ask their opinions about vaccines, and then give them some patient education pamphlets, which we designed ourselves. And then we'll offer an opportunity to talk to the patients more about the vaccines. Before the appointment, our MA staff does review the Wisconsin Immunization Registry, or what we know it as the WIR, to locate their vaccine records, print those, and make them available to the providers. So the providers then know what their history looks like and which vaccines they've received recently. As the program evolved, we decided to expand our reach. And so as of September 1st this year, we did go live in our 4 remaining Milwaukee area clinics. We do have another clinic that's located significantly further north of us in Manitowoc, and we did not include them for various reasons we may discuss later. But the 4 Milwaukee area clinics are spread throughout our geographic region and gave us better coverage of the greater Milwaukee area. So when we decided to expand, we did run into some pain points. So one of the things that we encountered right away was some provider resistance. So while at the two primary sites that we started with, the providers were very passionate about total worker health and about vaccine hesitancy and improving vaccine coverage in these populations, some of our providers at the other locations were less excited. And they gave us the reasons that we have listed on the slide. So more time on their part spent with the patients, more work because they needed to do some additional documentation in our electronic medical record, and then filling out referrals. And we'll talk about the referral process a little bit later in this presentation, so you'll have an understanding of why that might have been an issue for them. In addition to that, what we found was that in some of our sites, we got a lot of pushback from patients, and it was particularly related to COVID vaccination. So the Milwaukee area, as I said, economically diverse, lots of different patients being served, but a fair amount of vaccine hesitancy in this community. And some, of course, in an election year, some political issues as well, impacting that, I believe. So, so those were the difficulties that we encountered. We have a nice quote here from Michelle, who's our nurse practitioner at the McKinley Clinic, about how the providers interact with the patient. So she says, the process involves addressing patients' concerns or hesitations about receiving vaccines by discussing their thoughts openly. The patient's readiness to receive vaccine is assessed on a 0 to 10 scale. Tailoring the vaccine's need also includes considering the populations they will serve, such as first responders or healthcare workers who may face increased exposures to flu and COVID-19. For candidates resistant to vaccines, especially those working in healthcare with immunocompromised patients, the discussion emphasizes the risks to vulnerable individuals. Additionally, health benefits, potential side effects, and how to manage the side effects are explained. So that's the scripting, or very close to the scripting and process that the providers use. And then we asked the providers too about what they do when they face resistance from a patient. And Michelle is one of our more eloquent providers, so she provided a great quote that we're sharing. When candidates believe they have strong immune systems and feel they don't need COVID-19 or influenza vaccine, I still ask if they have concerns or hesitancy. Their readiness to receive is again assessed on that scale. I explain that even healthy individuals can contract COVID-19 or the flu, which can make them seriously ill or even cause death. Additionally, I discuss the health benefits, potential side effects, and how to manage those side effects. So the progress in our program, our goal has really focused on education and informing the unvaccinated patients about how the vaccines may be of benefit to them. So while some of these things are straightforward, some of them are less straightforward. So as a large healthcare system, one of our challenges always is getting the right individuals at the table and getting buy-in from folks outside of our department. So we did need to coordinate with multiple teams here at Froedtert, including our pharmacy team, our population health team, data analytics, and compliance and legal. So all of that took some time, and it sometimes does bog down our process. One of the pieces I mentioned before was the referrals. So as part of our program, in addition to recommending vaccination, we also wanted to be sure that we could direct people as to where to go to get their vaccines. While some of the individuals we see have primary care providers, a large percentage do not. And while our pharmacies are available and certainly can dispense vaccines, we did also want to try to make connections with primary care providers for those who did not have them. So while we thought that would be easy, we found out that it would not be, because we do our documentation in 2 separate electronic medical records. Very easy for us to place referrals in Epic, which is what all of the other providers use. So the referrals are readily seen and managed. But for those patients who were seen and had their documentation done in our Net Health medical record, we had a lot of difficulty. So we actually needed to create a new process. And so we use a referral form that the providers have to fill out. And then that gets faxed to a central location where the Epic team is able to input the referrals for us. So a little roundabout and a little more complicated, and thus a dissatisfier for our providers. We should note that Froedtert Pharmacy is the preferred location for individuals in our system to receive vaccines. And that's also a positive for us, because we're able to pull both Epic and WER reports from those pharmacy locations. I wanted to share with you an example of our patient education documents. This is an example of the COVID-19 worksheet that we hand out to patients with more information directly on the paper. And then we also, knowing that many of our employees and patients are on the younger side, decided to include QR codes too. So we could direct them right to accepted, trusted sites where they could get additional information about the vaccines. And then this is the same handout, but for influenza. Once again, with those QR codes available for patients to access additional information after they leave our clinic sites. So I'm going to let Krista talk a little bit about data issues, because she was very integrally involved in the creation of the work for this piece. So Krista, I'll hand it off to you.
All right. So when we initially took a look at acquiring data and reporting data, we had to consider our 2 EMR systems. So as Dr. Reitke described, we use Agility Net Health to do our visits that are paid for by the employer. So our pre-employment physicals, our FMCSA DOT driver physicals, things like that. And then our Epic system is used for work-related injuries. So 2 different areas to document and 2 different ways to track our data. And also through this process, we had to consider the extra steps on the provider. So during the visit, initially before we see the patient, we're reviewing the WER and identifying people who are due for vaccination. We're also anticipating that counseling to take place during the visit and needed a way to document that. And then also adding codes, if applicable, recommending a vaccine or indicating if a patient is refusing vaccination. And then that final step would be placing a referral if needed. We didn't need necessarily a concrete way to track the referrals in the Epic system, but that was applicable in the Agility Net Health. So we needed to create a variable that could be consistent across all of our visits for our providers that could then be used to reliably pull a report and determine the outcome of the visit. So we decided to use ICD-10 code that is both in Net Health, Agility, and in Epic to indicate that counseling was provided. As long as all providers were using the same ICD-10 code, a report could reliably be pulled for that specific ICD-10 code. So we made sure all of our providers knew which one we were using, Z71.9, if you're curious, but that was the one that we could, that was the variable that we could enter into our reports to run it reliably. We also wanted a way to indicate whether the person was interested in vaccination or refused. So in Agility Net Health, the way that we chose to denote that was by making a charge. We use our charge capture function for audiograms, physicals, any of our billing. So it was a charge but not with a monetary, it wasn't connected to any monetary amount, just a charge that we could pull the report from. So we have a charge that indicates vaccine recommendations provided, and then one for vaccine refused. The vaccine recommendations provided would be the people that we're following up on to then cross-check if they actually were vaccinated, to complete that report loop. The referrals can also be placed into Agility under a referrals tab. So that didn't require any extra manipulation with our charges or using an established ICD-10 code, more than just having our providers placing that referral into Agility. The referral could be placed into Agility to run our report, but would not talk to the Epic system to actually prompt our schedulers to schedule these people with our Froedtert primary care team. That's where that fax comes into play that Dr. Redke alluded to, where we needed to hand fill out a request for our primary care referrals that can then be faxed over to our patient experience team, and the patients can be scheduled on the Epic side. So all these extra steps you could probably imagine, where Dr. Redke touched on that resistance for the providers, a lot of extra clicks, a lot of extra counseling and paperwork to fill out. So you could see how that would be a little barrier there. But once you get into the habit of doing it, we found that if you get into the habit of doing it, you just becomes part of your natural flow. Now, when it comes to our Epic system, this was our work comp injuries. We again used an ICD-10 code for that report running, but was slightly easier because if a referral is placed to the primary care team, we can just indicate that right in that visit. So no extra faxing or paperwork is required for that referral. And I think that pretty much sums up our data issues. We do keep track of who we're sending the primary care referrals to in both systems.
And we have been relatively successful with that. We have referred 43 patients since we started that system up this fall. So that's great for us because we're really trying hard to connect people to a primary care provider and give them better access to care overall. So we did pull some education numbers to share with all of you, and it was actually good for us to do this because we submit data, but we needed to look at it too and get some ideas of what's going on. So you can see the first two clinics listed are the clinics that started in the program. So they've been in the program since May of 2024. So this data is about 6 to 7 months of data for them. And you can see that they've done a great job. 530 patients educated at North Hills, 550 educated at McKinley. Then we started in the fall at the other 4 clinics. And you can see the numbers for those. So we do have one outlier. It's our West Bend location, which is a slightly less busy clinic. It's more, I would say, small town / rural in its community, very conservative community. And there was a lot of vaccine hesitancy in that community due to political and ideological focus, I think. But that's still a really small number. So this is prompting us to circle back with our provider. We have one provider who reliably works in West Bend to talk to her about, is it a coding issue? Is it a workflow issue? Has she sort of forgotten about the process? Why is it that we're seeing such a low number at that clinic? So good for us to pull this data too. So the next steps, one of the things, this is called our wish list, really. One of the things we've wanted for a really, really long time is an HL7 interface. And the interface would allow 2 things. So right now, both of our medical records are capable of sending vaccine information to the Wisconsin Immunization Registry, which is great. However, while the EPIC information goes automatically, there's an automatic send, the agility information needs to be prepped as a file and then sent on a regular basis by someone. So during influenza season, for example, we have IT folks who work with us who are able to create that manual file, and then they send that off to the WER at the end of the influenza season. So we've needed to find a way to continue to do that. An HL7 interface would allow those records to be directly sent, and it would also be bidirectional. So we would be able to get information from the WER back into Agility, which is not something we can do right now. Epic does have that option, but we would also like for information to go from Epic to Agility and vice versa. So there are a few different ways that we could proceed with this and hopefully improve our data, and also be able to have a more real-time report of who's actually followed through and gotten those vaccines. That's the hard piece for us. The difficulty here, of course, we're big systems, so we have to get IT buy-in. We have some money from our grant, which is our carrot on a stick that we're sort of waving in front of the IT people right now, which is that, we understand there's work involved, but we have the money to pay for it, sort of a thing. So that's what we're working on right now. We do have an IT project team that works with us regularly, and this is our next step. So additional next steps for us, we would like to, in the course of the next year, expand our vaccine education program to include tetanus and hepatitis B. We are working hard. It's been difficult to get a lot of face time with our population health team. So several of us are working to get some more time with them to help to align our initiatives with the overall organizational goals. We're, as we mentioned, evaluating the current and future EMR use to determine best solutions. We wanted to let you know that in the middle of all of this, of course, Froedtert is integrating with another health system in Wisconsin who uses different EMRs. I mentioned that we didn't include our Manitowoc clinic, and one of the reasons we didn't is because that clinic is theoretically going to relocate to the North region, which is on different EMRs than we are, so we didn't bring them in. So that really increases the complexity here. We would hope that when everything is integrated, we could also expand this to our North region counterparts. We would like for patients to, have a patient portal that they could use to access their vaccination records through our non-EPIC EMR. So one of the things we'll be doing is looking at that Net Health EMR and comparing it to other EMRs to see if there's a better option for us with that portal. And then we have an existing employee vaccination process, but we need to further address how we can manage the non-Froedtert employees and how can we take our process and generalize it and/or create an enhanced process that works better for both groups. And then obviously future optimization opportunities for the program as we proceed forward. So with that, I think we've come pretty close to the end of our half hour. We appreciate you taking the time to listen to our presentation today, and again to ACOEM for offering us the opportunity to share with all of you. We hope it inspires some of you to embark on some vaccination improvement programs of your own. So thank you very much.
Thank you, Dr. Radke and Ms. Rogers, for today's presentation. As a reminder, please submit your Q&A via the Q&A chat, and I will take ahead and moderate those. We do have one question that just came in. Is this a pilot study / project?
So as we mentioned before, this is an ACOEM initiative that's been funded through grants from the CMSS and CDC. So we went through an application process. to apply for the funding that was given to us by ACOEM, and we were fortunate to be selected. So yes, this is a grant-based study. This CDC study is very overarching though. ACOEM is one of the specialty societies that's participating in the program. There are multiple specialty societies and sites across the country that are doing the same work that we're doing, and providing data back to CDC and CMSF.
Great, thank you. Could you elaborate on some strategies you use to get physicians to buy in?
Yeah, so we have a relatively small provider team, which is helpful. There's a lot of, if we had to generalize this out to our community physicians, we'd be dealing with hundreds of providers. So thankfully, we have less than 20, so it makes it a little bit easier. We started with some group presentations to, the group as a whole during our provider meetings. Our two champions, our nurse practitioner, Michelle, and our physician, Dr. Obi, also shared their experience and made recommendations to the group as to, what they felt was working best. And then now we're at that point where we'll need to tackle more of a one-on-one approach. So as I mentioned, that West Bend location that has really low numbers in comparison to the others, that's probably going to be a one-on-one with Krista and myself talking to that provider and asking the reasons why and how we can help if they have recommendations or suggestions for how to make things better. So group, and then narrowing it down more focused to those providers who are really either not performing or who really heavily pushed back.
Thank you. Another question that we have is, would you mind sharing like what type of training materials you utilize to do for the motivational interviewing?
Yeah, so we actually used a program. Krista, do you recall the name of the motivational interviewing program that we
You know what?
used?
No,
It was Dr.
but I could
Marianne
find it.
Shore. It was Dr. Marianne Shoren's program that we used. She was doing a study, and we were able to enroll our providers in the study. It was very well done. It was a really nice uh, recorded presentation that we watched, and then there were interactive parts of it, where we did a pre-survey checklist of what we knew about motivational interviewing. Then we did the training, and then we did a post-survey evaluation. It gave us some really nice feedback, and I don't know if she's published that or not, but she would be a person to reach out to if you are interested in interviewing.
Thank you. Appreciate that. And then lastly, what were some gaps in the care you recognized as you were promoting immunizations?
Yeah, so I think, as I mentioned before, I think the biggest issue for us, and Krista, you can maybe weigh in on your personal experience with this too. A lot of it was pushback from patients, either saying, some just flat out said they didn't want to hear about it, like kind of put up the hand and said, no, thank you. Others were, I think such a highly charged topic right now, particularly around COVID vaccine. What was interesting was to see how that spilled over a little bit to influenza, because historically we've had very, very good acceptance and uptake of influenza vaccine. And I'm going to be curious to compare our numbers this year with previous years to see how we did. I know for our healthcare system, where it's required, either an exemption or vaccination, and then our patient population, they just published the numbers for our overall patient population. The numbers for influenza uptake in our overall patient population went down this year. So that's not for our department, that's for everybody in the system. But I think we saw some spillover from public health skepticism into the influenza vaccinations this year as well. Krista, do you have anything that you want to share about your experience with counseling patients?
Yeah, I felt like with all those factors in mind, I found myself having to be a little bit more like tactful is how I approached people, and that made a big difference in their reception of the topic. So more of like a discussion, because not everybody was, or not most patients don't expect if you come in for an ankle injury that somebody's going to talk to you about updating your vaccination status and getting education on vaccines. So same when it comes to a pre-employment physical. So just in phrasing and how I phrase that introduction to people, I basically say, we're reminding everybody that's due for vaccination of influenza and COVID-19, that this is, we're in that season and we want to make sure that you have all the resources that you might need to obtain those vaccinations. Do you have any questions regarding that? Do you require any education? We have that here. So just kind of opening up like a no pressure conversation versus like, I see right here that you've never received a COVID-19, looking at my immunization list, more of like, we're just reminding everybody as a service to you and wondering if you need anything from us to be more educated and things like that. So, phrasing it in more of like a low pressure way, I found people being much more receptive to talking about it and taking our educational handouts.
Well, thank you so much for today's insights and for you all to presenting. So thank you, Dr. Radke and Ms. Rogers, for that. Do you have any other final conclusions or closing announcements?
I don't have anything else to add today, Nikki. Really appreciate everybody joining. If you have any questions afterward, certainly feel free to reach out to me. I'm sure the ACOM staff can help you to get in touch with me if you had anything specific that you wanted to ask about. We'd be happy to share in whatever way we can.
Thank you. So I just want to say thank you again and to our attendees. Thank you for joining us this afternoon. We hope you found this session informative and engaging. Before we go, we kindly ask that you complete the evaluation form that will pop up once this window closes. It'll be in a separate window once the webinar ends. Your feedback is invaluable in helping us improve for future sessions. So this will take you to the ACOM Online Learning Center website. You'll need to log in with your ACOM username and password, and then you'll be able to complete and submit your evaluation. Have a great day, and thank you all.